blocker?
Yes.
Okay, great. Linda asked in the chat earlier, good morning, Dr. Rita. Is the immune support a sufficient supplement to take to help build the immune system, or do I need to take additional C, D, and zinc?
If she's talking about Immune Protect, the
TLC Immune Protect.
the TLC Immune Protect, we designed to be an all-in-one single thing, but we left out the vitamin D because the variations of the needs of vitamin D are
very different from
very
patient
different.
to patient.
Yeah. So
and most of our patients are already taking vitamin D.
Yes.
So that's why we intentionally left it out. And sometimes you'll up your dose of vitamin D and sometimes you'll drop it. Mm-hmm. But basically to answer your question, yes. We created this formula going straight to the manufacturer with the highest quality ingredients to combine what we were prescribing, especially during this COVID scare. All of these, 2 or 3 or 4 sometimes different formulas that were great together. But to save our patients some money and to make it simple so you don't have to think about it, we put them all into one. So TLC Immune Protect is a wonderful supplement to take when it is when you are trying to prevent getting sick. It's great to take if you are sick, if you're traveling. The serving size standard is 5 capsules a day. You could increase that a little bit if you're feeling under the weather going on a trip. You could drop it down a little bit if you're feeling great and you're on a maintenance level. But yes, you would need to add in your vitamin D. And vitamin C is included in there, but it's not a very high dose of vitamin C. I believe it's around like 600 milligrams.
600 milligrams. And it's got quercetin in it. And quercetin is a known ionophore. It is helping get the zinc into the cell to stop viral replication. We've got N-acetylcysteine in it. We've got the mushroom, maitake mushroom group that helps the immune system. We have zinc in it. We have vitamin C in it, and so forth. So it's a very good product.
Great. And that is TLC Immune Protect. Yes. Mm-hmm. Okay. Question that was emailed into us from Sarah. She says, have you heard of studies on essential oils being possible endocrine disruptors? What are your thoughts, especially lavender and tea tree?
Yeah, I went over that on Monday night.
You did?
Yeah,
Great.
I did. And so it depends. I'm in favor of essential oils. It's part of the ancient Ayurvedic remedies and essential oils, but the producers and the quality are the variability here.
Just like anything, you have to consider the source.
Yeah, and so since it isn't regulated, I would say that there is a potential for being a dysregulator.
Right. Okay. Patricia emailed in a question and she said, how does one get a medical exemption? How do you feel? Okay, so that's her first question. So a medical exemption, depending on what state you're in and such, it's not a silver bullet, unfortunately. This is a conversation between a doctor and a patient if they believe that there is a justifiable reason based on religious beliefs, personal beliefs, or as to whether the doctor can write you a note. Doesn't mean that note will always work, depending on where you are, but ultimately nobody can force you to do anything or put anything into your body that you don't want. What are your thoughts on this?
Well, mandates are not laws. Guidances are not laws. There is a law that has been established. That's the Nuremberg Code, the International Criminal Court, the Helsinki Treaty, and our Constitution of the United States that protects your person and privacy. And then there's HIPAA law, where you're not to be asked, about your medical data. Your employer has no need to know these things. So these are what are the laws. Your Constitution is very valid. So the problem and the basis upon which I have been making decisions on exemptions is based on these laws. And number 2, and most importantly for me, I am held to the law to do no harm. And in that do no harm and in the Nuremberg Code and these things, you are to give informed consent and put no treatment to your patient without having full knowledge of its potential side effects, to inform the patient. So there's all kind of constitutional and international laws that protect what is called informed consent. how can I give informed consent when they're not letting us know what's inside these Moderna, Pfizer, J&J vaccines? And if they're not doing that, and if there's controversy, disease specialists over how to manage this, I cannot give informed consent. So I have to first do no harm. And that is the basis on it. Now, the other thing is by faith. We know that in the process of development, they use fetal cell lines. And so this is another issue in your faith, and that should be protected also by your constitutional First Amendment, so Bill of Rights. So that's where I stand, and that's how I manage it.
Okay. Debbie asks in the chat, what is the difference between a hemoglobin A1C test and the glucose test? They're both for measuring sugar levels, right? Thank you.
Well, the fasting blood glucose in your serum, that's that straw-colored material, is your fasting blood sugar, glucose. Mm-hmm. Whereas the hemoglobin A1C is how much of that is sticking to the protein component of your blood cells, hemoglobin. So they're two different tests. One is measuring an impact over 3 months. So if you're pelting and throwing darts of sugar at the protein and it sticks, we get an average over 3 months. Whereas your fasting blood sugar can be much more variable. You could have eaten something the day before your blood test, like if on October 31st, if you eat candy, then I check your blood sugar in the morning on November 1st. Then your fasting blood sugar will likely be higher than it would have been.
Right.
However, your hemoglobin A1C would show that the past 3 months you've been very cautious and careful with your blood sugar and starch and carbohydrate consumption, and it might show a very good reading of 5.2 or less.
Right.
So those are the differences.
Okay, A1C is a bigger, longer-term picture, a little bit more reliable of what your diet is consistently. Think of it as sticky, things that are sticking to that protein of the A1C, versus insulin is more immediate, what's going on today or the previous days. Now, we do want to see both those levels in a healthy individual,
yeah.
And assuming you're not insulin resistant, being low, right? We want to see fasting blood sugar below...
85.
85, and an A1C in a healthy adult below
5.2%.
Okay.
And again, we're more strict than your averages, but the average American is obese or overweight and has hyperinsulinemia. Another thing very valuable is to look at your insulin level. If your insulin is under 5, I prefer 3, but if it's under 5, it shows that your body isn't frightened, and getting ready for a big load of carbohydrate every time you eat.
Right. Okay, Patricia had a follow-up question, and she said, how do you feel about donating blood to a Red Cross blood bank after recovering from COVID? I donated several times 40-some years ago in my 20s and haven't since. I heard that the blood of a post-COVID person is valuable for helping sick patients.
Yes, it definitely is. I would definitely consider donating your blood through the Red Cross or some other comparable organization, and those antibodies, they might take your plasma for that.
Katie asked in an email, my son is 3.5 and has gotten sick 3 times in the last 2 months. I think he's getting all the germs a normal 3.5-year-old gets at his age. His symptoms each time are a wet cough, stuffy, runny nose, sometimes low fever, but nothing worrisome. He takes Juice Plus Kids gummies and your vitamin D liquid daily. I've been giving him 1 Kids D-His daily since he has continuously gotten sick. I also give him a small scoop of the vitamin C powder you sell daily as preventative. So the questions are, should I be doing anything different or more preventively? And when he is sick, what can I be giving him to help aid healing of his body?
I think you're doing a fine job in general for what I would assume would be an otherwise healthy 3.5-year-old. And they're going to have the sniffles and reaction as they explore the world, and their immune system is responding to it. Now, during the course of, if he has high fevers that are prolonged, or he becomes listless, not wanting to eat or drink, then these are serious signs that need to be seen by his pediatrician or a doctor or urgent care. What I would do, and I think you're doing this, Talon, is you're using Argentine Silver as a spray in the mouth, or some dropper in the mouth for the children. So the baby could have, a teaspoon or some spray or drops in the area twice a day, and that will help decrease the count of the virus or bacteria. Make sure that you're giving your child water, though, instead of juice, because juice is full of sugar. So give children water.
That was my first thought, was what's the diet and what's he eating or drinking? Plenty of water. And kids especially just gravitate towards sugar, and depending on who they're with, grandparents or relatives or at school, a lot of sugar and high fructose corn syrup gets snuck into that diet, and things that depress the immune system.
Correct. The white blood cell phagocytosis is depressed for 5 hours after like a glass of orange juice, an 8-ounce glass of orange juice, or a Coca-Cola. It's horrific. So please, people, don't do this to your kids.
Okay, let's see if we have any questions here in the chat. Robert, I think we answered your questions about testosterone and estradiol. So go back and view that if you think we got that, or let me know if we missed a point of your question there. Ophelia says, I have a sister that is 72 years old and her skin is dry, and now she has scaling and inflammation around her eyes. What supplements can she take?
Well, women, as we age, we lose our estradiol and we lose our ability to digest our proteins and fats, and your skin is made of protein and fat. So I would say a digestive enzyme with betaine hydrochloric acid. I use Orthomolecular's OrthoDigestzyme or Spectrazyme whenever I eat any food. The other thing is I use hormones. Without the hormones, some of the stimulus for repair and reconstruction and the elastin, collagen in the skin, and the same around your eyes. Older people tend to have their eyes fall, their lower eyelids fall forward because you're losing that elastin, collagen. I've lost some because I have a bit of a double chin now. But in general, compared to many people who are about 70 as I am, then I would say I'm doing very well on the wrinkling and the saggy skin. So hormone replacement therapy, digestive enzymes to get the collagen and the protein amino acids to reconstruct your skin and your whole body, and plenty of water, and be low carb.
Okay. Tom asks, how do you know if leafy greens are K1, vitamin K1, or vitamin K2?
Well, the K1 is the spinach, kale, romaine lettuce, all these things like this, because they haven't gone through the digestive 7 stomachs of a cow. A cow then will take that material, the leafy green and the vitamin K1, and it will digest it and manipulate the molecule into vitamin K2, which has nothing to do with blood clotting or anything. Vitamin K2 then is a animal product. It would be in raw butter. It would be in the dairy products and cheese and cream and milk of a cow. It would be in beef, things like that. So there are 2 different vitamins. They have 2 different functions. K1 is what the cardiologist tells you not to take to eat good food and spinach, because he wants an easier day managing his Coumadin blood thinner clinic. And I tell my patients, eat healthy and let him adjust to your healthy diet, you know. Whereas K2 has nothing to do with blood thinning and such. It has everything to do with bone health and other aspects of calcium and endothelial lining protection. Some even say helping your brain, anti-aging and stuff like that. So it was, in ancient times, the first dairy of the year from the first greens of the spring. They would save the butter and the cream from the animals, the goat milk and the cow milk and stuff, because this was so full of the first year's spring vitamin K2 for fertility, so it was associated with fertility.
Okay. So another question that says, what if you can't take bioidentical hormones because you had hormone-positive breast cancer? My skin is very thin right now since I started taking tamoxifen.
Well, that's a challenging question. That has to be handled between you, your oncologist, and a doctor who's very familiar with natural hormone replacement. There is a book out there called Estrogen Matters. That's the title, Estrogen Matters. Read that book and you'll see that estrogen is not the cause of breast cancer. If you were to take a biopsy of me, almost 70, and my cells will have estrogen receptors positive to it, and it'll have progesterone receptors positive to it, because that's a healthier cell. That is a cell that has more of its original healthy features retained. So whatever tumor they're saying you had, it wasn't very malignant or aggressive, and the E2P2 breast cancers are always the ones that do well because they really aren't as quote-unquote malignant. So this is something you manage between your doctor and you. I have many women who I work with, their oncologists, and they have chosen to go back on natural hormones for their sleep, for their immune health, because if you don't sleep well, you're not going to have a good immune system, and for many other benefits, bone health and such. So it wouldn't be fun to survive your breast cancer and then at 68 trip and fall with your grandchild and break your hip and then die of an infection in the hospital from that. Right. So everything is a balance. That's what you would have to do. But I'm going to have to see my patients.
Okay. Well, everybody, that is all the time we have for today. Tom, I see your question on there, and I see a few more rolling in. I want to let you know that Dr. Althorp has a second weekly show that she does on Monday evenings. At what time are we sticking with? 6. Okay. I know so 6 p.m. Mondays. Same channel. If you're subscribed, which I ask you to do if you're not already, and like the video if you saw any value out of it, that helps us get the word out there more. So please take a second and hit that thumbs up, and if you haven't already subscribed to the channel. Monday night, 6 o'clock, that tends to be a longer show, so bring your questions on Monday, and we'll be back here on Wednesday, and I'll make sure that any questions that didn't get answered today got answered. You can email your questions in throughout the week, office@tlcdoctors.com. Make sure you put in the subject question for YouTube, Q&A, something like that, and that question will make it over to us. Thank you, everybody. In the meantime, be well.
God bless.